South Dakota Foundation for Medical Care has been a federally designated quality improvement organization and peer review organization since 1973. So we partner with the Centers for Medicare and Medicaid to evaluate the quality of care for Medicare beneficiaries in our state. The projects that we're currently working on, CMS, the Centers for Medicare and Medicaid, have tasked us with doing an environmental scan and really looking at some data that's already been gathered in our state related to opioids and chronic kidney disease. So we are looking at mostly what is some of the opioid death rates, or what might be some opioid adverse drug events that are happening. How is blood pressure managed in those who have been diagnosed with chronic kidney disease? Or how do we look at the diabetes population and see if there's been some new diagnoses of chronic kidney disease, and really kind of unique to South Dakota, such as our ruralness, and how does that affect the data that we have? How do we share our data across the state? How are healthcare systems able to talk to each other? What are some of the methodologies that they might use for collecting data? Really innovative ways that we can initiate some quality improvement measures. And then how do we evaluate that, really looking at the data that we gather through that? So CMS really has us work under the triple aim, and the triple aim is better health care, and lower costs. So as we gather all that data, we are able to report that back, and we're able to analyze that and see, did we improve the health care of certain populations in the state? Did we improve the health of the populations or individuals or Medicare beneficiaries? And also, did we do that in an effective way that we are lowering the overall cost of healthcare for our state? Some of our best successes have been, for instance, we've worked with clinics in evaluating the colorectal cancer screening practices, and so we've worked with them specifically to identify their data and see where they may have some gaps in their screening, and then help them to set goals that are aligned with the national strategy of the 80% by 2018. 27 emergency medical services squads in a certain district in our state, and taught them about sepsis and the importance of identifying sepsis very quickly. And we saw a 47% relative improvement rate in the deaths that occurred as a result of sepsis or septic shock. And so we're going to be working in the nursing homes, also going to be working with community coalitions. So identifying those stakeholders in the community who really have an interest in some of these broad aims as well. And we know that when we partner with those stakeholders, we can see better improvement and we can reach more people. So that's really important. And then we'll also be working directly with the clinics and with providers.